Many parents notice their child's teeth look yellow even though the child brushes every day, and that worry is completely understandable. Brushing is important, but tooth color is influenced by several factors beyond daily brushing, such as enamel thickness, natural tooth structure, diet, and plaque buildup. For example, a parent may notice their child's permanent teeth look darker or more yellow than their baby teeth did. Another common example is a child who brushes daily but still develops slight yellow staining along the gum line. These situations are very common and often normal, so noticing them does not always mean something is wrong. Tooth color isn't determined by brushing alone, it is influenced by the structure of the tooth itself. Teeth have multiple layers: the outer enamel, which is relatively white, and the underlying dentin, which is naturally yellowish. When enamel is thinner or more transparent, the yellow dentin underneath becomes more visible, making teeth appear more yellow. Some children naturally have thinner enamel due to genetics, which can make their teeth look more yellow even if their teeth are healthy. A common example is a child whose genetics give them slightly thinner enamel, allowing the dentin to show through more noticeably. Another example is that new permanent teeth often contain more dentin than baby teeth, so they can appear darker as they erupt. In many cases, this natural color difference is completely normal and not a sign of poor hygiene. Even when children brush, everyday plaque can still accumulate if brushing technique is not thorough. Plaque is a sticky film of bacteria that can harden into tartar and create a yellowish appearance if not removed properly. Children often miss areas while brushing, especially along the gum line and on back molars where plaque tends to collect. For example, a child who brushes quickly may miss the molars where plaque builds up more easily. Another common example is a child who brushes but does not floss, allowing plaque to accumulate between teeth. Regular dental cleanings are important because they remove hardened plaque and tartar that brushing alone cannot eliminate. Diet also plays a role since certain foods and drinks like berries, juice soda, and colorful candies can gradually stain enamel. Acidic foods and drinks can also slightly wear enamel over time, making the yellow dentin underneath more visible. For example, a child who frequently drinks fruit juice may begin to show mild staining over months. Another example is a child who snacks often on brightly colored candy and sports drinks and develops gradual discoloration. Brushing after meals, rinsing with water, and limiting staining foods can help reduce this type of discoloration. Some yellowing can also result from dental conditions, such as enamel hypoplasia, where enamel does not form correctly. In rare cases, illnesses, developmental issues, or injuries during early childhood can influence tooth color as the teeth form. For example, a child whose enamel developed thinner than normal may show generalized yellowing. Another example is a child who experienced an injury to a tooth which later affected its color compared with neighboring teeth. If discoloration appears suddenly or affects only one tooth, it is worth having a dentist evaluate it during a checkup. There are practical steps parents can take to help improve appearance and oral health starting at home. Supervise brushing until children develop proper technique and make sure they brush for 2 minutes twice a day. Encourage daily flossing as soon as two teeth touch because plaque between teeth can cause discoloration even if surfaces are brushed. Limit sugary and staining drinks such as juice soda and sports drinks and offer water, especially between meals. Rinsing with water after meals and waiting to brush for about 30 minutes after acidic foods can protect enamel. Schedule regular dental visits for professional cleanings and to assess any developmental issues that might affect tooth color. If discoloration is due to genetics or enamel thickness, your dentist will explain the options and reassure you that health is the priority. In some cases, cosmetic options may be available once teeth are fully developed, but those are decisions to make with a dental professional. To recap, yellow teeth in children are often a natural variation influenced by enamel and dentin, not just by brushing alone. Plaque buildup, diet, and rare medical or developmental issues can also cause yellowing, so it helps to review habits and see a dentist when concerned. With good techniques, supervised brushing, flossing routine, dental visits, and sensible diet, most causes of yellowing can be managed or explained. If you notice sudden changes or a difference in only one tooth, make an appointment so a dentist can evaluate and recommend next steps. Remember that a reassuring conversation with your dentist can often provide clarity and a plan tailored for your child. If you would like, I can provide a quick checklist of home habits and questions to ask your dentist at your next visit.